Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about what to expect 1 year out from knee replacement surgery. So, of course, I have to lead with a disclaimer that people are going to vary pretty significantly in terms of symptoms, quality of life, mobility, physical status, functional status, especially at 1 year out from having surgery. You know, we're all different people, different characteristics, different medical comorbidities, physical status going into surgery, and of course throughout the recovery after surgery. So in general, things are going to vary quite a bit, but these are just some general guidelines. And also just understand that a lot of things are going to come down to things that are outside of your control, things that you really can't do anything about. Your genetics, your disposition for certain things, what you were in the past before surgery. We can't necessarily change the clock of time. So there's many things that are outside of your sphere of control, and that's something that's good to keep in mind as you go forward with your knee replacement. So for the vast majority of people, you're going to be 90% to 100% recovered from surgery, meaning that you've kind of reached your potential in terms of your strength, your mobility, your physical status, your functional status. You're there. You're probably at your max if you're not, maybe 90% recovered. Now, you may still see some improvements with things. These improvements will take time, and they're not going to be as dramatic as they are those first weeks and first 2-3 months after surgery. But you can still see improvements in your strength, in your symptoms and pain, in your mobility and activity tolerance. These things can continue to improve over time. The key with that is just being consistent with a physical activity program, doing different exercises, and managing your knee replacement and your body and your health appropriately. So you can still see some small improvements, but again, these will take a little bit longer and they're not going to be quite as dramatic. Now, you also unfortunately may still have some lingering symptoms. This is common, this is normal. Pain, stiffness, swelling, some noises that the knee replacement may be making. These are common. For most people, these symptoms diminish little by little over time. They diminish in how intense the symptoms are and how frequently you experience these symptoms. Now, there may still be days where you're very busy, so you're on your feet a lot. I always hear about people that go to an amusement park and they're walking around with their family all day and they're on their feet all day. You may still have a little bit of an exacerbation or increase in symptoms on days like that. But for the most part, the intensity and the frequency of these symptoms will start to diminish, although they may still linger to some extent. And this is very common and normal. Now, you may not have any symptoms or hardly any symptoms, but you also just may not feel that your knee feels normal. It doesn't feel like a normal knee. You know that something's different, something's in there, and this feeling may last for the rest of your life, or it may kind of gradually go away as you stop kind of thinking about your knee and stop, kind of just go on with your day to day. So there is that feeling, and there's a pretty good percentage of people who, even though their symptoms are very minimal or maybe even none, and they're back to their normal quality of life, they still may know and kind of feel that that knee is just not normal. It's not your normal knee, and that's okay. Now, there's hopefully for the vast majority of folks, you're going to have a lot more mobility in the knee itself, being able to move the knee fully or, within what our target and goal is after surgery, and also mobility for yourself, being able to walk and do things and tolerate activities much more. Now, it's important to understand that, one, a knee replacement doesn't turn back the clock of time. So, just because you got a knee replacement and hopefully you're tolerating and doing much more and you're much more mobile and physically active and physically capable, you're not necessarily going to go back to when you were a 20 or 30-year-old. So just having a good perspective about that. And it's also important to remember, like I said at the beginning, people are going to vary significantly. So you may really have a minority of folks, unfortunately, who are going to still have some issues and not totally be satisfied with their knee replacement at 1 year out. And, that may be because of pain, that may be because of just not having the mobility and the activity tolerance and the functional abilities that they thought they were going to achieve. So that is possible. Knee replacement, is it a perfect surgery? It's a pretty good surgery. It's not great. It's not perfect. So there are going to be some folks at 1 year out where you may still have some frustrations, unfortunately. Now the big take-home message I want to send with you is continue to stay physically active, continue to perform exercise, do whatever you enjoy and you can do consistently. People ask me what the best exercise is. The best exercise is the exercise that you are going to do consistently and perform consistently and not get caught up and dissatisfied and not want to do it. Again, also just general things about managing your knee replacement, trying to get as much longevity out of your new knees as you can. That's avoiding, risky, high-impact behaviors and activities. It's just maintaining overall health, healthy body weight, eating healthy, physical activity, I already said. Of course, all the other things, stress management, sleeping well, are all very important for overall health, and it's going to help your knee as well. So just be aware. The last thing I want to say, be aware that, there still can be issues a year out to many years out. Some red flags to keep in mind are an intense new onset of pain or swelling or other symptoms, a feeling of instability, so a new onset of a feeling of instability or buckling or looseness of the knee joint. And those are some symptoms that, you may have something where the knee replacement is loosening, it's breaking down, you may have an infection. So just some of the red flags to be aware of, as this can happen, unfortunately. But for most of you, now is your time to enjoy the benefits of your new knee, enjoy the increased mobility, the increased physical functioning and status and ability to tolerate things and do activities that you enjoy with people you enjoy, and just get the most you possibly can out of your knee replacement and your body in general. Please be sure to hit that subscribe button, turn on the notifications to catch all videos related to knee replacement surgery. Please be sure to hit that like button to spread this video, and your comments and questions below. I get back to everyone I see. Thank you very much for watching.